Hi, everybody. It's 2:59. We're just kind of waiting for a few more people to come on in, and then I'm sure Teresa will take it away.
Yeah, we're going to give a couple minutes because we have a lot of people listed as who come to RSVP. Because we have so many, we don't get to do my favorite part, which is introduce and meet every Zoom player. We can't because we use up the whole presentation if we do that. So we're not doing that today. In just a minute, Kate is going to bring up the peer website because we're going to talk about the fact that we now have password protected two things, a resource library and the membership, which this is brand new. We talked about this at the dinner before FSGA, but this is brand new. And I want to make sure everybody knows about this, especially because if you didn't receive a notice about the password, it's because you have to log in. Oops, sorry about that. It's because you have to have a Facebook with the peer group. And to do that, you reach out to Kate or go on to Facebook, right? Actually, Kate, can you show them, I'm sorry, can you show them that Facebook view so they know what they'll be looking for? So the reason you're doing to go on to Facebook is you're going there so you can join Facebook. It's a closed group. It's not public, which means you have to be vetted. Kate vets you against your OPPG list or your employer OPPG list. And then she'll reply back to you that you meet the criteria, because we don't let anybody into this group. You join this group. This is called the Guardian Peer Support. This is the Facebook group that you want to join. And then there you'll be able to receive your password. And then you'll be able to go into the website, the peer website, and that will allow you to see both the resource library and the membership list, which is everybody who has joined the Facebook group and is part of the peer group. So go ahead, Kate, click back to the website for just a second. I want people to get a visual. So we're talking two things, Facebook and then the website. You have to join Facebook, get approved by Julie and Kate and myself, and then you'll be able to come here to this is the website. This is the Guardian website, peer website. And these two last items, resource library and member list, those are password protected because the rest of it is public. It's a public website, but those two items are not public. So that's that. Okay, let's see. So for some housekeeping stuff, we have so much to do. We can't possibly get it done if we have questions during it. So you have an option of putting some questions in chat, and we'll try to get to them at the end if we can. And then that's the best shot because we're going to run out of time otherwise. All right, Kate or Julie, any more housekeeping stuff? No? Okay.
I think we're okay.
Okay. All right. So Sharon, your screen is, unless it's my visual, your screen is kind of like blurry. Does it look like that to you guys or just me? A little blurry?
Sharon, try turning off your camera and then turning it back on.
She's like, what? You know, it may, Sharon, it may be how far away you are, because when you leaned in a little bit, I think it got a little better.
She looks clear on my part, but I don't know.
She does. Okay, maybe it's me. Maybe it's me. Thanks, Alexandria. Thank you. That's good, Sharon. That's good. Sorry, didn't mean to create tech drama.
Yeah, tech drama.
I know. I'm sorry.
Thank you.
I'm sorry. So, okay, right before the introduction, if you guys look in the chat, this is something we put out every time when we do anything with the peer. It's kind of got all the things for you to click on. Well, the dinner just happened, so we should have took that off, but the dinner is there from last week. It's got resources, it's got our website, it's got aged webinars and all the contact information. So that's why all this is there. It's just so you can get to all the peer and aged stuff. All right. No more talk. Sharon, please. Well, you guys all probably know Sharon. I'm just gonna let her introduce herself. How about that?
Okay. Hi, everyone. Thank you so much for having me today. My name is Sharon Rich. I'm the Senior Trust Advisor with AGID. I probably talked to many of you on the phone over the years and possibly saw you at the FSGA conference in Orlando last week. My background is as a trust officer for over 30 years. I have been with AGID for 12 years, managing special needs trust exclusively. So we, as you know, we like to be a resource, so please feel free to call us anytime. We have a whole team of people here that can help you. I am going to share my screen today and go through the presentation that we have. So hold on a second. Let me get all my screens set for that. And okay, are we good?
We're good, it worked.
All right, okay. Today we are going to talk about benefits and how a pooled trust can be used to qualify for extra Medicaid benefits and reduce healthcare costs. As many of you know, Aged is a nonprofit company. We've been in business for over 20 years, and part of our mission is to support and provide educational resources to the community. So we have a lot of guardianship programs and resources for the community. So I do a lot of speaking around the state. Our primary business here at Aged is managing special needs trust. We have the Aged Pooled Trust. We manage the Florida Public Guardianship Pooled Trust and individual special needs trust. So if you are looking for a trustee for an individual special needs trust, we can be named in those documents also, as well as, utilizing our pooled trust. I've got quite a few slides today. Some of you may have been to my presentation at FSGA. This has a few additional slides, just a slightly different presentation, but it never hurts to hear these things more than once. We're going to go through some of the Medicare programs and some of the Medicaid programs that correspond with Medicare, like the low-income subsidy and the Medicare savings programs. We're going to talk about pooled trust and also a little bit about long-term care. This is a great slide on your Medicare choices. Many of you guardians have wards that are on Medicare, and there are two ways to choose your Medicare benefits. One is what we call original Medicare. That's over on the left-hand side here. That's your Medicare A and B. That only covers 80% of the cost, though. So when you're on original Medicare, you also have to have a Part D Medicare pharmacy plan to cover your prescription drugs. And if you want that extra 20% covered, you're going to have to buy a supplement for your client. A lot of times when you have a disability, it's hard to get a supplement. So, and it's expensive too. So a lot of people, including just, our senior population, I believe it's over 50% now of people on Medicare have what we call a Medicare Advantage plan. That's your Part C, which is a private, it's governed by Medicare and CMS, but it's a company like a Humana or a United, something like that, where you have an all-in-one plan. It's going to cover your A and B services, like your hospitals and your doctors, and all of the other benefits and services, as well as prescription drugs. But when you're on an Advantage plan, as most of you know, you have copays. We actually talk to a lot of people here at Aged who are struggling to pay for just the copays. There's usually an out-of-pocket maximum for the year of $5,000 or $6,000. And if someone is living on a limited income and has very little savings, sometimes even just affording a test like a $300 MRI or a hospital visit can really dig into their income or their savings. So, and sometimes they're not getting those tests and those services or buying their medications because they feel like they can't afford it. I'm going to talk about some programs today that include Medicaid to go along with the Medicare that can help reduce those out-of-pocket costs. So if you're on original Medicare and you get Medicaid, you can have your Medicare and Medicaid that way. If you're on an Advantage plan, sometimes you can move to a Special Needs Advantage plan. I just worked with a client, however, who has an Advantage plan and they're moving into a nursing home. You've probably heard a lot of nursing homes and rehab say, hey, you have to get rid of your Advantage plan. You need, the original Medicare. Well, let's think about that. If you're in rehab and you drop your Advantage plan, you're going to have copays that, you have to pay. So how are you going to afford that? And that's where the Medicaid very often can also come in and cover those copays. Andy is 78 and Andy is struggling to pay for his health care. He's lives in a manufactured home, has a couple dogs, and he is diabetic, COPD, has anxiety and depression. I'm sure you've heard this story before. Andy's spending $300 a month on medications and he needs knee surgery. And he's thinking to himself, now how can I afford all of this? And also, I got to buy my food. I got to feed my dog. What's going to give? Andy's making $2,000 a month in income, and he has $14,000 in the bank. Sometimes I meet people that have nothing in the bank. Andy's lucky. His monthly expenses are $2,700. So that's $700 more than what his income is. So every month, Andy's dipping into his savings to the tune of $700 a month. Andy's money's only going to last 2 years or less. So he's really struggling to, maintain and his expenses, his money, and get the health care that he needs. This is the Medicare coverage gap or the donut hole. You've probably heard about this. Just very quickly on how this works. This is related to your prescription drug coverage. At the beginning of January every year, Medicare says there's a deductible for your prescription drugs. It's somewhere up to $545. When you're in that initial deductible period, you have to pay 100% of the cost of the drugs. Once you meet that $545 deductible or whatever it is for your plan, then you're in what we call the initial coverage period. This is where you pay smaller copays and the plan is going to pay a larger portion of the medication than you are. So in the initial coverage period, hopefully the drugs aren't too expensive, but sometimes they are. There's a lot of tiers that they put on the drugs these days. And it seems like, more and more of the drugs that some of our clients take are more expensive. So what happens when the total cost of the medications since January reaches $5,030 is that you go into the coverage gap, or also known as the donut hole. So that's the total cost of the drugs, what you have paid plus what the plan has paid. Reaches $5,000, you're in the gap. When you're in the gap, the drugs cost more money. So it makes it even harder to afford the medications. Medicare says, okay, well, you can get out of the donut hole once the total cost of the drugs reaches $8,000. So a lot of people, once they go into the donut hole, they never get out of the donut hole. And for the rest of the year through December, they're paying, a large cost for the medications, or they're cutting their pills in half and they're not taking the meds. Once it reaches $8,000, then they're in catastrophic coverage and they're not paying anything this year once they reach that catastrophic coverage. So this is, a problem for a lot of people, and we are going to talk to you about some programs that can keep people out of that donut hole and keep the cost of their health care affordable. So low-income subsidy is also known as extra help. You've probably heard of this. You may have seen colored letters come in the mail to you for your wards, and it says you may qualify for extra help. There are income limits and there are asset limits. This program is related to the prescription drug cost, and it is actually managed by the Social Security Administration. If you can qualify, if your ward can qualify for this, then their medication costs are going to be less than $12. So $0 to $12 if you qualify for this program. It's really a fantastic way to reduce the cost of medications. There's no annual deductible associated with this program, and there's no premium. If your client is paying any sort of a Part D premium, it's going to be $0. That's the prescription drug plan. There's no donut hole. And again, once the total cost of the drugs reaches $8,000, they pay absolutely nothing, $0. Great program. Again, managed through Social Security. You have to have Part D coverage for this. If you have full Medicaid coverage, like they're in a nursing home or they're on community Medicaid, this is the program that's paying for their medications. If they're on SSI, this is the program that's really paying for their medications. If you think your client qualifies for this, call the Social Security Administration or apply online for them to get this benefit. One of the great things about this program too is that you can change your drug plan once a quarter for the first 3 quarters of the year. As you know, generally with Medicare, you pick an Advantage plan, you can't change it until the next year. With this program, you can actually change your prescription coverage if you need to. It's a great program if your ward meets those income and asset requirements. Now, there are also what we call Medicare savings programs. All of these programs that you're looking at here include the low-income subsidy. So if your clients can qualify for these programs, they're going to get the low-income subsidy to help pay for the medications. But these programs also have additional benefits. These are managed through DCF, Department of Children and Families. So this is Medicaid through DCF for people that have Medicare. Now they're going to have Medicaid like a supplement, is the way I like to look at it. We like to talk about QMB a lot because it has the most benefits. Out of all of these Medicare savings programs here, QMB has the most benefits, and you can see why. The income limit for QMB is $1,255 a month. The income for the other programs, SlimB and QI1, is higher. So of course, the lower the income, the more benefits. That's the way the government looks at it. With QMB, an individual can have $1,255 a month in gross income. That's before any deductions. If your ward is married and living together with the spouse, then a couple, they are going to look at both incomes. The couple can only have $1,704. Assets, Countable assets, 9,430 for an individual and 14,130 for a couple. Now, you know, a lot of people say, well, what counts as an asset? This is your typical Medicaid scenario where, you know, anything you can get your hands on really counts. Savings accounts, checking accounts, investment accounts. IRAs either count as income or an asset. 401ks sometimes count as assets. You're allowed to have one car. You're allowed to have a house. And I think I have a slide on here. It's somewhere around $700,000 that the house equity can be in. What trips people up sometimes with the assets, just FYI, is life insurance. If your ward has life insurance with cash value, that may count towards this asset limit. So what do you get with QMB? You're going to get the low income subsidy that we've already talked about to reduce the medication cost, but you're also going to have the Part B premium paid for you. That's the standard Part B premium this year is $174.70. So generally, you know, if you look at the letter that comes at the beginning of the year from Social Security, you'll see that your ward has a gross Social Security amount, and then there's a deduction for the Part B generally. If you get qualified for QMB, there's no more deduction for the Part B premium. So the client will get a letter from Social Security saying, we're changing your monthly amount. We're no longer deducting that Part B premium. So the benefit goes up, the payment goes up. So that's a great benefit. That generally, like in Agent's case, that covers the trustee fee generally. Medicare deductibles are paid by Medicaid, and the coinsurance is paid. So that's the big thing with the QMB benefit. And the reason a lot of people really want this is the coinsurance. That 20% is covered. It's zero. There's no copays when they go to the doctors, the hospitals, rehab, the surgeries, all of that. Now, when you're on QMB, you're called dual eligible, Medicare, Medicaid. This means the doctors are not allowed to bill you. If you have a ward on dual eligible QMB, Medicare, Medicaid, and the doctor bills you, that's called balance billing. They're not allowed to do that. You need to give the doctor this information right here and say, you're not allowed to bill my client. As long as Medicare approves the expense, Medicaid is going to cover the difference. So the doctor's not allowed to bill. The doctor accepts them. They're accepting them as a patient. Okay. So we can help with this if you need any help with this, but that's one of the great benefits of QMB. SLIMB and QI1, the other Medicare savings programs that have these higher limits, include the low-income subsidy. They pay the Part B premium, but there's no help with the deductibles or the coinsurance. So if Andy got SLIMB, he'd have to pay his copays for the surgeries and the rehabs and all that. Okay. So we're going to try to get Andy on QMB to help him reduce his out-of-pocket cost. How do we do that? We need to get Andy's countable income and assets down below the limits. So using a special needs trust is a way to do that. All of these types of special needs trust here on the chart allow individuals to qualify for Medicaid. That's what a special needs trust is all about. They all have different rules, and I don't really have time to go into all of the different, types of rules, but note, some of you probably have heard of a qualified income trust. In the context of nursing home, these work great. That's where an attorney drafts a trust. Client is only over the income limit and they're going into a nursing home. If you want to, pay a legal advisor, an attorney to draft a trust, you can get a QIT. You can manage that as the guardian. You go to the bank, set up an account, and run the income into that and pay the nursing home. A pool trust, excuse me. Get my voice back here. A pool trust has to be managed by a nonprofit company. That's why AGIT is structured as a nonprofit organization. The trustee has to be a nonprofit. A pool trust is more flexible than these other types of trusts because you can also put assets into it, and there are no age limitations on using the trust. You do have to be disabled in order to use a pooled special needs trust. And what that means is if you're under 65, you're going to be on some kind of Social Security disability, SSI or SSDI. If you're 65 or older, you just have a lot of medical conditions that prevent you from working. So all of the people that use AGIT's pooled trust have a lot of medical conditions. They're either disabled or they're seniors and they just have a lot of medical conditions. They're unable to work at least full time. So that, you can work a little bit as long as it's not more than that substantial gainful activity amount. All right, so AGIT is trustee, or there's other trust companies around the state of Florida, probably about 10 or 12 trust companies that have pooled trust. When the money's in the trust, you can use it to pay for things that government benefits do not pay for. So sole benefit, pay for lots of things out of the trust. I have some slides on that. One of the rules about using a trust, a pool trust, is you have to pay Medicaid back before any money goes to heirs. So we'll talk about that a little bit more. But it's a great way to get benefits for an individual that really needs it. So it's your beneficiary's money going into the trust. This is called a first party trust. Trying to qualify for Medicaid. Again, here's your slide that I just kind of explained all these things, how you must be disabled. When you open a pooled trust, some people don't realize, but you have to provide medical records if the client's not already on SSI or SSDI, and Medicaid will review those medical records, make sure they meet that definition of unable to work, okay? Trust is used to pay for things that Medicaid's not going to pay for. Why would we pay for it if Medicaid wouldn't? And it has to be for the sole benefit of your client. These are just some of the rules that we have to go by. A lot of people say, this sounds too good to be true. Well, this has been around for a long time, since the Omnibus Reconciliation Act of 1993. And the codes for the pool trust are right in Medicaid's guidelines down here. So I like to point out in the yellow here, it says that a pool trust is a legal instrument that meets the criteria in the U.S. Code and allows disabled individuals to place income or assets into the trust to qualify for Medicaid. So note, it says income or assets. When you use a pool trust, you do not need a QIT trust also. You can use the pool trust just like a QIT. You can use it for income, but you can also use it for assets. A lot of people don't know that. This is a great chart. This is how a pooled trust really works. The income, your client's Social Security is going to continue to go in their bank account. If they have any pensions, it continues to go into the bank. You figure out how much they need to put into the trust, how much they're over the limits. They have to put at least that much in, like every month if it's income. They can put more, but they have to put at least enough to get under the income or the asset limits. And then the trustee is going to use the money to pay for lots of different things: facility, rent, utilities, cell phone bills, guardianship fees, all sorts of stuff. So Andy establishes a pooled trust, and he is now going to qualify for QMB. He's going to take out of the $14,000 that he has and deposit $6,000 into the trust. That leaves him with $8,000 outside of the trust in his checking account. He has monthly income of $2,000. He's got to get that under the $1,255 limit. So he's going to put $800 every month into the trust. At Aged, we actually can set up a transfer from checking into trust, so you don't have to do it every month. This reduces countable income so that Andy can now qualify for QMB. You got to tell DCF about all this. You got to do the application, submit the pooled trust documents to DCF, along with everything else they always require. And then they send you a notice back and say they're now qualified for QMB. What happens? Andy's medication costs are going to go down to $30 a month. So he's saving $270 just on his meds. No copays for the doctors in the hospitals. Another savings, he has a knee surgery, pays nothing. His physical therapy is free. And his Social Security check goes up by $174.74 because now the government is paying his Part B premium. That is an offset to the trustee fee. So it truly is a win-win for Andy. We're going to help him increase his income every month, because right off the bat, in my example, we're putting the $115 in there as a trustee fee. He's no longer paying the $174, so his income is going up by $59 a month. His medical expenses are going down by $500. He's going to now switch to a dual eligible plan. So, once he gets this, let's say he's already on United, he's going to go back to United and switch his plan, tell United he's qualified for QMB, and they'll switch him over to their special needs plan. This is going to save Andy, $600 to $1,000 a month. So now he can really get the health care he needs. He can afford it. His money's going to last a lot longer. Some of you probably know that the Advantage plans, when they have the special needs Advantage plans, give you extra benefits. So it's not only all this copay coverage and medication costs, but extra dental coverage, extra vision coverage. Sometimes you get over-the-counter prepaid cards that you can take to the drugstore and spend $150 or whatever it is. Sometimes they give food benefits. And now they're even letting you pay your utilities expenses with some of these cards. So getting on a dual eligible special needs plan is super helpful to someone trying to really reduce their out-of-pocket cost. We get a lot of questions. What can you pay from the trust? Well, sometimes, not all the dental expenses are covered by Medicaid. We recognize that. And we do pay dental expenses sometimes. If someone's not on SSI, we can pay their rent, their mortgage, their electric and utilities, things like that. If someone's on SSI, there are some restrictions over with that kind of thing. There's a change in the SSI rules that's going into effect at the end of September. You may have heard food is no longer considered a problem for trusts to pay for. So we can, as of end of September, we can pay for food. And some of the rules on shelter are going away too. So look for changes and information about that coming. That will be super helpful to your SSI clients. Purchase of computers. We buy tablets for some of our clients, television. We pay for pet needs, cell phones. Over on the right-hand side here, some of my examples. Some of the clients still need companion care and your guardianship services. We still want you to get a court order for your guardianship fees and then submit those to the trust for payment. Okay. Legal expenses, lots of things that we pay for out of the trust. The big rule is out of a pooled trust, anything we pay for has to be for the ward, sole benefit. A lot of people say, well, okay, how does the trust work? How do I know what's going on? At Aged, we provide quarterly trust statements and also we have the ability to go online and view the trust account balances statements. You can get monthly statements online. So we give you the option of also having online access to view everything so you can see what's going on every single day. That really helps to provide transparency. To make a disbursement request, you as the guardian would be the beneficiary advocate. It can be, if it's not a guardianship situation, it can be a power of attorney, it can be a friend, it can be whomever the person chooses when they sign all the legal documents. Again, these pooled trusts are managed by nonprofit organizations, so there's going to be a fee. So you always have to, consider that. At Aged, we will assist with the Medicaid application for our income-only clients. We also, will help to an extent with, a smaller trust. We don't want to take any business away from attorneys that are doing Medicaid planning, etc. But we will assist. We actually have 2 benefit specialists. We're happy to talk to you anytime. And we are a special community partner. We actually pay for a half a DCF caseworker. So you can use, and please do, whether you're an attorney, whether you're doing the application or we're doing it or whatever, the application can be routed to our caseworker and who understands what a pooled trust is. And it speeds up the application process usually and helps eliminate a lot of the problems that you may have with trying to, get Medicaid approved. So know that you can use Aged for that. You just have to contact us and ask for our help on that. Okay. So here's how you join a pooled trust. There's what we call a joiner agreement. It's a fill in the blank document and you're joining into a master trust. There's a fee agreement that goes along with it. Those are the basic legal documents that have to be signed in any pooled trust. And you're going to be, obviously providing information about the beneficiary, their date of birth. We like proof of social security number and date of birth. fill out all the documents. As a guardian, you have to go to court to get approval to establish, in other words, sign the pooled trust, the joiner agreement, and to fund it. So if you're looking for, if your attorney's not familiar with doing that, we have a sample petition on our website and order that you're welcome to utilize. So basically, you're going to go to court, get approval, you're going to sign all the documents, provide them to Aged along with funding, a check, that kind of thing. And then we open the trust, well, we accept it, notarize, etc., and then open the trust. Once that's all done, then the Medicaid application can be submitted along with copies of all the legal documents. So at Aged, we send you back a welcome package, and it kind of outlines what Medicaid needs when you're using a pooled trust. You got to show them the money trail. They want to see the checking accounts. They want to see the money going into the trust, proof of all of that. They want to see the trust documents, etc. So we can help you with that if you've never done that before. In summary, what do you need to really think about? When might your client really need to use a special needs trust? So again, we're talking about seniors not working full-time and persons with disabilities who can either not afford their medications or spending a lot, can't afford their doctors and their hospital copays. I have people that I had a lady who I went over to her house. She was referred to us, went over and visited with her. And she told me, oh no, I don't think I need your services. I just don't take the medications that the doctor prescribes for me. You've probably, heard that and experienced that before. So I left, said, okay. And 3 months later, she called us back and said, you know what? I think I really need your services. So we actually opened a pooled trust for her and helped her to get the care that she needed. Someone entering a nursing home happens all the time. They've still got, any amount of money. There's no limits on what can go into the pooled trust. It can be $10,000. It can be $5,000, it can be $100,000, whatever, the case is. And, a nursing home costs $10,000 a month. So most people that go into a nursing home go on Medicaid because you're going to be spending down that money real quickly. What you need to think about is, you have a client going into a nursing home, they do not need to spend down their money to qualify for Medicaid. Go to an attorney, get all the, figure out what all the options are. A pooled trust is one option. Medicaid, you might have your developmentally disabled wards at group homes, that kind of thing. ABLE account is a great option if their patient account starts going over the $2,000 asset limit. Sometimes it's more than that. They might get a settlement. They might get an inheritance, and now they have too much money. A pooled trust is a great option in those cases. You may have someone that goes into a nursing home and sells her home, or assisted living, and they sell their home. Again, pooled trust is a good option in those cases. Now, you've probably heard of the waiting list for home and community-based services. That's one of the long-term care programs that helps pay for assisted living and services at home. So a lot of times people are on the wait list, and now the spot opens up and they still have too much money. We get a lot of those calls too. Okay. And this is another way to look at it. I've had I've worked with some of the guardianship offices on just kind of going through their book of clients who might benefit. Again, this is a great way to just visualize people who can't afford their meds and copays, nursing home assisted living residents, people who can no longer work because of a disability, and your developmentally disabled adult population. This is your chart on the other types of Medicaid programs for disabled individuals and people that are over 65. Okay, you've got your SSI, your community Medicaid. We've talked about QMB. You've got your long-term care and nursing home, long-term care and assisted living, long-term care at home. And here's your information over here on the bottom right for the waiting list. If you need to get someone on the wait list for, you know, the Home and Community-Based Services Program, you're going to call your area agency on aging through your Disability Resource Center. If you need more information on that, we actually have a great flyer that has a little bit more information about those types of things. The waitlist program. Got a few more minutes. I want to just talk, show you the numbers on the long-term care programs. You know, most everybody thinks, oh, the limit for Medicaid is $2,000. That's where this comes from. You go into skilled nursing, you're only allowed to have $2,000 in countable assets. Or you go on the long-term care program, you know, for the ALF. $2,000 in countable assets, but the income limit is $2,829. So these are different than the QMB limits. Okay. The couples, let's see, I think I have a slide. Maybe I didn't put that in here. The couple limit here is for like 2 people going into the nursing home. If you have one person going into the facility and the other person is still at home, they're allowed to have more money, the person staying at home. And your personal needs allowance is $160. That means your client, when they go into a nursing home, is going to have to pay the nursing home their income less $160. They get to keep $160. The rest of it's going to the nursing home. I did put a slide in here on medically needy share of cost, because a lot of people that apply to Medicaid, you may have clients, oh yes, you know, they're on Medicaid, well, they're on share of cost. This is a more like catastrophic insurance. Why would somebody be on share of cost? Because they've applied to Medicaid and their income's too high. They have limited assets, $5,000 or less, right? And they apply to Medicaid, they have $3,000 a month. Well, Medicaid's going to say, we don't care what your income is. As long as you have less than $5,000, we're going to give you share of cost. Your share of cost is going to be your income minus $180. That means that you're going to have Medicaid once you incur medical expenses equal to your share of cost. And so what happens, I'll give you an example. Let's say Andy has $2,000 a month and he has, you know, no assets. He applies to Medicaid and he's living at home, and they say, okay, your share of cost is $1,820 a month. That means that Andy has to incur medical expenses of $1,800 a month before Medicaid kicks in. I had a client, one of the first clients I ever opened a trust for, who was going to the ER room at the beginning of the month because he was on share of cost. George was trying to, incur a medical expense of $1,800. He had chest pains on the first of every month and ended up in the ER room. They finally told George, we know what you're doing. You can't keep coming back to the ER room. So he found out about the trust. He did the trust. We got him on, community Medicaid until he got his Medicare, and then we got him on the QMB. So in other words, George was trying to incur $1,800 in medical expenses, and he'd have Medicaid for the rest of the month. And then it would start all over again the next month. Very difficult program to manage. So if you've got someone that only has share of cost, that's a red flag. There's other programs that can better, give them more benefits. And that's, if you need help thinking through that, just give us a call. We can help you think through which program might help your client. These are the programs we deal with these day in and day out. And I've kind of given you a summary today of some of the programs, like the low-income subsidy for prescriptions, the Medicare savings programs that include the scripts and some additional benefits, and how to qualify for some of these by using a pooled trust. I have websites for you, that, can supplement what we've talked about today. Happy to make this presentation available to you also.
Okay, so Sharon, we've got some chat stuff. Can I ask you the question now? You ready for them?
Yep, I'm ready.
All right. So let's start with the first one I came across. Says, what dental expenses other than cosmetic does Medicaid not cover? Well, I'm going to switch that question around. A better way to ask that question is, are there any Medicaid providers in your area for dental? Because that's a huge problem. So, for example, if someone's in a nursing home under ICP, they use one of those Medicaid nursing home dental programs that comes to the nursing home and does an oral cleaning and some other work. I hope that answers your question a little better, because it's not the question of cosmetic. It's more the question of who's the provider available. Is it community Medicaid or is it ICP Medicaid? I don't know if that helps you, but you can't answer that question with this one answer. It's more pieces to it.
Right. I mean, like Medicaid is very willing to pull teeth, but
once,
are they going to give you a root canal? Are they going to give you, implants and things like that? No.
It's sometimes you can get Medicaid to deal with infections and abscesses, because that can fall on the medical side, but not always. Teresa Brockett asked, was there a fee for the assistance, meaning the Medicaid assistance that AGID performs? And I answered, no, there's not. AGID provides that service to no cost. So
that's right. Yeah, as part of our trustee fee, we just provide that as an additional service.
Yeah. Then they question, will the slides be going out? Yes, Julie and them answered that they'll be going out with the certification email. So another question from Patricia. Patricia, I'm not sure I understand your question. She says, AGID charges a set admin fee each month, but another pooled trust company I use includes dividends and interest and thousands of dollars in unrealized cap gains loss each month. Can you explain, Sharon? Can you explain that?
Okay, so that, the trustee fee is an expense, obviously. The dividends and the interest are because the money is invested. And at AGID, yes, we do invest our clients' money also. We use TrueLink. Some of you are familiar with the TrueLink prepaid cards. Well, they also have a pooled trust software system and their investment advisors. So we use their trust system and their investment advisory services. Our kind of general policy at AGID is that if someone has more than $25,000, we will invest them in one of the 3 model portfolios. So we have three different, a 20, 80, 40, 60, and a 60-40 allocations. When someone is invested at any trust company, you're going to see either, in a pooled trust, generally you're going to see a lump sum on your statement for interest and dividends. So,
She's
like
saying-
in our statement, it'll show, interest and dividends as a, total dollar amount, like for the quarter or for the month. And then you'll see gains and losses as a lump sum.
I think Sharon, her question is that the pool trust she's talking about, I don't know who it is, and that's fine, charges the dividends and interest, like maybe as part of their fee schedule. That's what I think she's saying.
Charges,
That's what it
dividends,
looks
and
like.
interest?
Patricia, would you clarify? You want to come off of mute and clarify? I want to make sure we have your question right, because I'm not sure I'm understanding it. Patricia Myers, you want to come off of mute and help us understand your question?
Yeah, hi,
Thank
can you hear me?
Thank you. Yes.
I think actually Sharon probably explained it, because the trust, not the Aged trust, but the other trust to which I refer, is with clients who have over $100,000. And I notice with the Aged trust that I have, it's no more than 12,000 or something like that. But the other trust company, again, I am just appalled. Sometimes it's as much as $5,000 in losses, and it often is more often losses than gains.
It is.
So it's significant numbers for, say, a trust of about $300,000. But I
Yeah.
guess that's standard when you have that kind of money, to have that breakdown of interest, or excuse me, really unrealized capital gains loss is really the major charges.
Well, we can never figure out, we can never predict what the market's going to do. I was just looking before this meeting at TrueLink's investment reports. They give us, Aged, quarterly reports. So I can see what each model portfolio is doing. This year, all the portfolios are up. We had one year a couple years ago where, when the bond market was down and the stocks were down also, but generally, the hope is when you're invested, the money's going to earn, a return. I think our returns are somewhere, between, 0 and 8% right now on the portfolios for the year. So can't predict, but you can certainly ask what allocation your client is in. They ought to be able to provide that to you. I can provide, like if someone's in our moderate portfolio, I can actually provide them with that quarterly report that TrueLink gives us. It's client ready. So if you're not getting the transparency you need, keep asking, and you're entitled to it.
And you also can consider talking to your attorney about whether, if you guys know what asset allocation means, it means what kind of risk grouping are they putting this money in? That's what asset allocation means. Is it a lot of it in high risk, a little bit of it in high risk? There's all kinds of separations of how that is. So if you're not feeling comfortable at the losses that you're seeing on any investment, whether it's pooled trust or any investment, reach out to your attorney or your CPA and talk to them about, do you need to look at a different allocation, maybe a less risky, that also means less gains, but it also can mean less losses. If you're uncomfortable about that, that's a conversation you should be having with your attorney and maybe your CPA about, or your financial advisor. Is this in the best allocation it should be for a person with this age, with this time horizon, with this need for money? That's definitely a conversation to have.
Yeah, we look
But
at a
would
lot of
I-
ages when we're trying to decide which model portfolio to put them in, because the more stocks you have, the riskier it is. And so you want, the older people, we usually use more conservative portfordelios.
Yeah, understandable. But wouldn't I reach out to the trust company to get that information? Yes.
You'd start there. But if you're not happy, then you go to your attorney or your CPA if you feel like you're not getting a straight answer.
Yeah. Okay,
Okay.
thank you.
Okay, so we have some more questions. Let's see. The next one is, does Aged have any Spanish speaking staff? Julie?
Well, We do not have any Spanish speaking staff at this time, unfortunately.
Shoot.
You know, we
Okay.
try to make, we can try to make accommodations, but we don't, no.
And Lori, if you haven't started trying it yet, because I know some tech is really not fun, but Google Translate on your cell phone, it's pretty good. And if I'm telling you tech is good, that means something because I suck at tech. So, okay, we got some more questions. Cheryl's asking, can you pay your attorney from a pooled trust? Sharon, you want to answer that?
Yes, absolutely. So we pay legal fees, quite often. If it's a guardian that has established the trust, generally the guardianship fees and the legal fees are going to be approved by the court, and then you're going to submit that to us, with a disbursement request. If it's just if it's not a guardian that is, the establishing the trust, then we pay legal fees without court order.
And so to clarify too, Lori, the question might also be if you're talking about a different attorney. For example, if you're talking about the court-appointed attorney that represents the AIP or the ward, or you're talking about the attorney that represents you as the guardian, or you're talking about the attorney that represented the petitioner. So make sure that you know who's the players are and who they represent, because some of those can be paid and some not. She says, yes, I'm talking about my guardianship attorney. Yes, you can. Most attorneys, well, it depends on how your attorney works. A lot of them will file your fee petition and their fee petition at the same time. So you get those court orders at the same time. Really depends on how your attorney functions.
Right. Now, let me just say something while I'm thinking about it. Just one thing that should be mentioned is that we do not pay anything after someone passes away.
Oh, God.
In a pooled trust, you're not allowed to pay anything when someone passes away. Okay, it's Medicaid rules. So I encourage you to bill on a regular basis, number one. And you can always too submit a disbursement request with your legal with your billing at the same time you submit it to the court. Just tell us to hold, which we will anyway, but hold the bill, hold the payment until you get the court order. Right. And that way, what happens is if we have a bill before and then somebody dies, so we have it before they die and then they die, we're allowed to pay it.
Great. Okay. Thank you, Sharon, for talking about that. So guys, really get that in your head with pooled trust. Death means no dollars. So this includes everything. So one of the things for you to think about in your process or your procedure is if you got a client going on hospice, look for an opportunity to prepay things that might kind of meander. One of them is your bond premium, not your $50,000, but that individual ward's bond premium, because sometimes people don't die exactly on time. They don't exactly die at the 3-month or the 6-month mark. If you're talk to agent, if you've got a client that's teetering on passing away and you've got a facility bill and you've got a homeowner's insurance for their home bill and other bills, call agent and talk to them about what your options are. Talk to your attorney. Some attorneys will advise you prepay those things. If it turns out that the client passes away, you can get the reimbursement back. That's fine. But what can happen is that your ward dies on Monday and then you're going, oh gosh, it's going to take me 3 months to get this guardianship closed, and the homeowner's insurance policy came up for renewal. Don't be in those shoes, because it's sometimes really hard to fix. And sometimes, as you well know, it takes way longer to close a guardianship. When people tell me it takes 1.5 years or 2 years to close a guardianship, it shouldn't, but that is not uncommon, not uncommon. I want to mention something that I always struggle with. When people call something 5 different names, it gets really difficult. So if you hear somebody say waiver or ALF waiver or home and community-based program or the waiver program, that's all one program. Everybody just has a different name for it. And if you're confused, I was confused for years. I kept saying, what's HCBS compared to ALF waiver compared to waiver? Ice cream, ice cream, ice cream. It's just people call it a different thing. So when you're with somebody and they're talking about a program and they call it a name you don't recognize, try to drill down to what exactly program are we talking about? And if you don't understand it, don't be surprised. The other comment I want to make is when you're having a ward that you're starting to look down the road and you get to a number that starts to make you feel uncomfortable about whether or not you should do Medicaid planning. You need to start in your head with a mathematical number. My personal number for years was about 100,000. When we hit about 105 or 110,000 on a ward situation, I'm going to my attorney to talk about whether we should be doing Medicaid planning now or not, because you have to get a petition, you have to get a court order, they might want a hearing, maybe the family wants to argue. It may take a couple months to get that done. Meanwhile, you're blowing through whatever you're paying private pay, and you may get, you know, $12, $15, $18, $20,000 going out before you qualify. So start to give yourself some kind of a ticker. You know, maybe it's a dollar amount, or maybe you just divide their cost of care by months and you say, I don't want them to get below 6 months or 8 months of money. Start thinking about that ahead of time so that you're ready, and any delays that happen kind of while you're flush with money, and it's not scary. Because if you start Medicaid planning when you have a month and a half of money, that's late. That's really late in the game. Okay.
Yeah.
Other thing I wanted to talk about was going back to the share of cost. I think that gets really confusing. Here's the way to think about it. Share of cost is a monthly Medicaid program that's a PIA, paying in the A. Every month, that person has to get qualified for Medicaid. And the way they do it often is they go to the ER with chest pains. If you ever want to see this take place, go to the ER the first, second, or third of the month, and you'll see it. They'll walk in and they'll say, hey, Joe, there's our frequent flyer, Joe. Joe, are you having chest pains tonight? Yes, ma'am, I am. They go in, they do whatever diagnostic they need to do. And the minute they do that diagnostic, he's now qualified for Medicaid, because it's not when they paid the bill, it's when the bill was incurred. So if that gets confusing to you, share of cost is just a pain in the neck, and it's extremely rare that you'd ever want to keep somebody on it. I can actually think of no reason that you would ever want to keep somebody on share of cost. You get them on QMB as soon as you possibly can. Okay, so I'm going to chat. I think I see we've answered all the questions. So you guys want to ask a verbal question, you can come off a mute and raise your hand. Or if you want to put it in chat, we'll look for more questions or things you're not sure about or feel like you need some support on. Go ahead. I'm looking for.
So
Go ahead, Sharon.
while we're waiting, I wanted to talk about one more thing a little bit, and that's what happens when somebody dies with a pooled trust. Because I thought I had another slide, but sorry, this presentation didn't have another slide on it. And, you know, different pooled trusts have different options. The basic rule about a pooled trust is when someone dies, if you've named heirs in the joiner agreement, Medicaid has to be paid back first. So that's the rule. The government says we're going to let you do this during your lifetime, get the Medicaid, but when you die, we got to pay Medicaid back first before any money goes to heirs. So I'm going to give you an example. So in AGED's joiner agreement, we have the ability to name heirs. You have two options. You can either leave 100% to AGED, the trust, or you can leave 10% to AGED, pay back Medicaid, and then to heirs. Okay, two options. If you choose to name the heirs, you know, might be looking at the will, you're the guardian, you want to follow the will, fine. Somebody dies, we write to Medicaid and say, how much did you spend? Okay. They've been in a nursing home for 2 years. It's over $200,000, and we only have $50,000 left in the trust. What are we going to do? We are not going to pay a partial amount back to Medicaid. The rules and the trust, everything allows AGED to keep the $50,000. If it was a guardian that, you know, established the trust with us, we are going to take that $50,000 and put it back to our guardianship benevolent fund. And I know all of you on the call in the mentoring program know what that fund pays for the pro bono cases for you and your attorneys. Okay. Now let's say they only were in the nursing home for, you know, 2 months. So we write to Medicaid, and Medicaid says, our lien is 20,000, and we still have 50. Okay, so age is going to keep 10%, 5,000. We're going to pay Medicaid back 20. We now still have $25,000 left to split among the heirs. So we're going to go get W-9s from the heirs and all that kind of stuff. So, you know, it is, you know, flexible as to what you want to do, you know, at death, but you still have to abide by the rules. You know.
Sharon, I want to add my favorite story about a pooled trust to get you thinking this in your head. I was guardian of a very elderly gentleman in his 90s and his very young 40 developmentally disabled daughter. I became the guardian because the mother, who was a nurse, passed away from caregiver exhaustion. Can you imagine? So the mother had done a reverse mortgage and had the big chunk of cash sitting in Bank of America, big chunk of cash. We needed to get that money into a way in which dad could qualify for the nursing home, Medicaid, daughter could qualify for APD, group home, and we could still, upon dad's passing, get that money to the daughter. Aged was at the time the only pooled trust willing to do that. And the best part about it was Medicaid drops out of the middle in that situation. When the dad passed away, which was very shortly thereafter, his pooled trust cash went straight into the daughter's pooled trust, and Medicaid was out of the conversation. So when you've got a ward or a client that has a family member or close connection or somebody that has disability and might be able to use money in a pooled trust, talk to your attorney, talk to Sharon, call her and explain the situation, because that's one of the little special magic things that can happen when you are involved in multiple family members of or friends of a ward or a client. Now, you're going to need court order, especially in a guardianship. Now, these are clients that are not guardianship that you may not need court order. You'll have to talk to your attorney or talk to Sharon. But this is something that's kind of unique, and it's becoming more common now because we've got 80, 90, 100-year-old gals living that to their 90s with 30, 40, 50-year-old developmentally disabled adult children that have lived with them their whole life. So you're not only needing to care for the mom and her money, you're needing to care for the daughter. I do see a question. Alexander has a question, so come off of mute and ask your question, dear.
Hi, so I have a woman who I am trying to set up I guess one of the trusts, but I went with a FIG, but maybe I should have gone with aged now that we're talking about it, because the woman has a sister who was under guardianship by the woman we are now guardian over. So basically, the ward of the state that I have was the guardian over her sister. And now she's like starting to decline pretty swiftly. So I'm trying to figure out, can I switch from a FIG to an aged, and how does that work?
Great question.
So Alexandra is with one of the public guardianship offices, you know, and so, you know, the Florida Public Guardianship Pooled Trust, the only option at death there is the money goes back to the foundation for indigent guardianship, and then they're going to let the public guardianship pooled trust use the funds, you know, based on a budget. So again, you know, each pooled trust has little different options at the end. I do not know that you can actually switch from a FIG pooled trust to an aged pooled trust.
I don't know. That's a great question. And Sharon's going to come back with an answer nothing right now, but find out if so. You know, Alexander, I have a question. So when you guys are in the public guardian, do you have the choice of what trust to use?
Yeah, I mean, we can decide based on how much, you know, like we do set budgets beforehand just to see kind of where they would land. And then we try to decide which ones would be best fitting.
You know, I just assumed you guys had to use FIG. So I'm really glad you brought that up. I just assumed that. I didn't know. Okay.
No, there are some public guardians that in certain cases do once in a while, you know, they'll use the aged trust because of that type of situation. So that's education. And that's why I appreciate Teresa inviting me to speak today. And, you know, because there's always something somebody learns, hopefully, you know, when you hear it again. So I apologize for you not knowing in advance. It is a little, you know,
It's a nuance. That's the whole
Yeah,
point.
It's
of
a
the
learning
nuance.
curve.
There's always a little nuance to something. I've been doing this for 30 years. I didn't know that
Yeah.
answers that question, Alexandra. So I'm
But
glad
you'll
you
know it for the next client, that's for
We
sure.
sure will. We sure will. Okay, I don't see any more chat questions. If anybody wants to ask a question, I don't see any yellow hands up or someone to start talking. I don't see any. It is 4:14. Sharon, is there anything specific more you want to say?
No, just thank you so much, you know, and we really appreciate the Guardians and what you all do and love to help. So don't hesitate to pick up the phone anytime, you know, we're here.
That's good. So you guys should go to click on the chat and roll up to the top, the very beginning of the chat. And that's got like most of the peer and aged stuff you might want to click on. It's got our Facebook group and the peer website. Julie, what's our next date of something happening? Let's see, today's the 25th. I think it's what? Let's see, first week of August? What?
Well, let's see here. So we've got, hold on, I'm pulling up the website too.
Okay.
So we've got the second Tuesday of the month, roundtable discussion. So in August, that will be the 13th.
That's at 8:30 a.m. So now, if you guys don't know, on the peer roundtable, which we'd love more people to attend, because just what Alexander asked, that is a question that has not come up before. And when more people attend, we hear a new question. So we like more people attending. So we have 3 Zoom roundtables a month. And there's an 8:30 in the morning. There's a 3:30 or 3
So the
o'clock.
3 o'clock one is the third Wednesday of the month, and that will be on the 21st in August, excuse me. And then we also have one the last Wednesday of the month. It's always the last Wednesday. So in August, that looks like it will be the 28th.
And that's our evening one.
That's at 5 p.m. For those of you who can't make the early morning, can't make the afternoon, we did a 5 o'clock one too for you.
And one
Or
of the
you can make all of them.
Yeah, one of the big reasons we did that, we were being told that a lot of new Guardians were still working full time and they couldn't make the morning or the afternoon. So we added another one because, gosh, new Guardians need this the most. So that was why we added that. So, okay. So I think that's enough. If you haven't joined Facebook already, please reach out to Kate, join Facebook, which means you'll then get a passcode, which will then allow you to be on the peer website, which will allow you to go into both our membership, which is everybody on the peer, and also our resource library. So if you haven't done that yet, please do. All right, guys.
And also, speaking of Kate, she's going to be sending out CE certificates and PowerPoints and all that good stuff very soon to all you guys.
Okay.
So keep an eye out for those.
All right, guys, I think we're good. It's 4:16. We closed kind of on time. Thank you, everybody, for coming. Look for the next great one from Agent. Take care, everybody. Bye-bye.
Bye.
Thank you guys. Bye.